Hey everybody, welcome to From the Constituency. I'm Brian Calfano, joined by our friend and familiar face, Charles Dahan from DC. Charlie, as I call you, good to see you. Listen, I am aghast. I opened the New York Times a couple days ago and I see that we are now up to over 700 cases of measles, a disease that we thought was eradicated because of vaccines. Now,
This is right.
the worst outbreak in decades, according to the NY Times. What is going on?
Well, people aren't vaccinating their kids for a variety of reasons. So, about a decade ago, I guess more than that now, a doctor committed one of the worst cases of medical malpractice and fraud in medical research. Former Dr. Wakefield in England, claiming some link between the MMR vaccine,
so that's measles, mumps, and rubella. I don't know anything about rubella. It sounds like a dessert, but at any rate, measles.
It's not.
Doesn't it? Can I have some of that rubella with the cherry sauce?
That's rhubarb.
Oh,
but thank you, Dr. Calfano. He said that there was a link between it and autism, getting the vaccine and autism. It of course, is complete nonsense. There is no connection between the two. There is nothing at all unsafe about the MMR vaccine. In fact, vaccines are perhaps the greatest thing that we as human beings have ever accomplished. You get the vaccine, you're impervious to diseases that killed our ancestors.
Now, what's interesting about this is, according to my Facebook feed,
yeah,
I almost can't say with a straight face. According to my Facebook feed, these vaccines are actually dangerous.
Right.
And they've got like pig feet in them and things like that.
Right. Well, you know what?
Where does all that come from? You say this guy in England was discredited about a decade ago. But
he was. You have other fraudsters like Jenna McCarthy perpetuated this.
Jenny McCarthy, this is that MTV person, always a great source for medical advice, right?
Well, people took it seriously, and it's just these lies have blossomed, right? And now you have communities. There's some in California. It's now officially a health crisis in New York City. Amongst particularly Orthodox Jewish community there. There's a big outbreak, but lots of different communities. We're seeing outbreaks all over the map, and kids are going to end up being very sick and die from this. There's also a really sort of insidious and incorrect belief that measles isn't dangerous. Well, measles absolutely kills people and leaves them with lifelong ailments.
Well, wasn't it the governor of Kentucky who said that he lets his kids just get not smallpox. Is it smallpox? What does he let them get? Pneumonia? Chickenpox.
Chickenpox.
He lets them get chickenpox because it's supposed to build up their immune system. Isn't that the idea?
So it is true that if you get chickenpox once, you're much less likely to get it again. But
you get shingles. You get shingles, especially after watching this podcast. It'll just set you off.
I don't think it's that bad, but possible. I don't know.
All right, so let's get back to this basic idea of a lie goes out.
Right.
Saying that, what is it? Vaccines are linked to autism was the original finding. Not that they don't work. It was they're linked to autism.
That was the original lie that was told by Wakefield. Yes.
Why did he say that? Do we know?
I haven't asked him. Doesn't really matter.
Next. Why didn't you do that? Go find this guy. He's got to be working down at the 7-Eleven now or something. See what he said. Well, the motive is interesting. But what's even more interesting, I think, is the fact that people just continue to believe the lie. Wasn't it allegedly Hitler who said the bigger the lie, the more people will believe it?
I don't think it was Hitler, right? But certainly it was a Nazi, right?
It was one of those Goebbels or whatever.
Yeah, I think the issue is that you have parents who hear something that they're very concerned about, right? I don't know the motive between perpetuating the lie, but it certainly makes sense, right? If I'm a parent and I hear that my kid might get autism, if I give them this vaccine, and then I'm told that, well, the disease won't kill my kid, right? They may get this disease, it may be unpleasant for a bit, but they're not going to die, right? Then my cost-benefit analysis might be that I'm not going to give the vaccine, right? So that I guess is the logic behind it. and autism is very, very scary.
But there's been such a pushback on the falsehood. It's almost
Yeah.
as if people say, no, 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 I'm just going to double down, even though all of these experts are saying this is a complete fabrication, the link doesn't exist. You have anecdotal episodes where people say, well, I know so-and-so got that
Right.
shot, and then they ended up being on the spectrum.
Listen, the President of the United States even perpetuated this lie.
Always a good source for scientific knowledge.
Well,
President Trump.
he came out and said that he believed there was a link, right? And he saw a link. And again, so you have these different sources that are perpetuating this, really incorrect and very, very dangerous information. Now, here's the really, really problematic part of this. There are certain kids, immunocompromised infants, for example, that can't get the MMR vaccine. Right? They simply cannot get vaccines. So what we need is herd immunity, right? You need 95% of people to get this vaccine.
This is called, you said herd immunity. So in other words, like most of the cattle, we're cattle. We've got the shots. It's going to keep those who are immunocompromised safe from getting it. That's the idea.
Right.
Okay.
Right. And the problem here is that if these infants that cannot tolerate the vaccine for a variety of reasons, completely unrelated to.
It's because they've got pig feet in the vaccines. That's why they can't tolerate them. Nobody should be able to tolerate them, right?
Listen, I've eaten pig feet, and I'm
pretty good.
I'm
Put some
I'm a healthy
Worcestershire on it, and it's great. I hear you.
I'm on the diet, but no, the vaccines don't have anything like that in them, right? But some infants can't get it, and so parents that are irresponsible and selfish and don't vaccinate their children are placing these infants at risk, right? There are very few things that I think a parent, really should be obligated to do. You have plenty of choice in terms of what you can, how you can educate your child, right? How you want to raise your child. But the minute that you bring your child into society with the rest of us, right? Into a public school, into a mall, into a hospital, right? Any of these public settings, we can't allow for, due to lies and just false information, parents to place other kids at risk. So what's happening now is you're seeing laws, for example, a proposal in Missouri that parents are going to be allowed to, or should be allowed to, not vaccinate their children, and then those children should be allowed to go wherever they please. But in a lot of hospitals, pediatricians are saying we need a separate waiting room, right, for parents, for kids who are choosing to not get the vaccine. We need a separate area, right, in schools, or kids have to get vaccinated to be able to go into a school, right? And those are good policies because they keep all kids safe.
Well, they're also expensive policies. You got to build on more facilities, right? I mean, you got to split people up. You're talking about the right to do whatever I want as a parent, and then the logical extension of that is, like you're saying, separate facilities for these different groups, which is insane.
Right. Yeah, and based on nothing, right? Based on lies and just complete false.
And anecdotal. Now that we should do a whole topic about anecdotes and how much of the world rotates on anecdotal discussion.
Well, and one interesting thing I think about anecdotes is sometimes they're true, right? Sometimes there's an anecdote of
like stereotypes. Sometimes there's sometimes there's confirmatory evidence, like people with beards, for instance.
What
not
about
being as clean as others? But I digress.
It's hurtful. You're a hurtful fella.
I'm sorry, Charlie. But there was a study out that said that men's beards trap a lot of bacteria. In fact, I saw that right after I read about the measles case.
I've been roped into quite the conversation here. I merely want parents to have correct information, vaccinate their children, so their children don't have to suffer from measles, mumps, or rubella.
Rhubarb. Got it. Well, I guess the answer to bring it all home is to just continue to push back on this misinformation about vaccines. Right?
Yeah, I think pushing back on...
Because it seems as though some people are just really going to dig in and just not try. It's almost like this anti-elite, anti-expert trend in society. In other words, well, the doctors and researchers don't really know and they're hiding something, and so it's up to us, the regular people, to sort of use our anecdotal information and what we think is our common sense to guide the way.
I think there's absolutely that trend, right? And again, physicians and medical researchers, obviously, there's a lot that we don't know. But one thing we definitely know is that vaccines work and are safe, and prevent suffering and death in society, right? We don't see these massive outbreaks of really horrible infectious diseases that have either potentially lifelong consequences or fatal consequences. Right? We just don't see those anymore due to the miracle of vaccines. And I can't disagree enough with these pieces of legislation, I think, that are moving forward that would allow for parents to be able to not vaccinate their children, right? But then also allow the kids to be able to go into any space that they want and be very hazardous and dangerous to other children. So, vaccinate your kids, keep them safe, don't force them to have to endure really painful and horrible illnesses.
Or keep them locked up in a barn somewhere, but don't have them go out among us.
That's terrible parenting advice.
Yeah, but it's better than not doing the vaccination and then sending them out with the rest of us, right?
That's not something I've considered. It's not a choice that I've.
Seems logical to me.
Right.
I mean, you know how I am with kids.
Don't lock your children in barns and get them vaccinated. I think it's pretty simple.
Words to live by. Charles Dahan from DC. We appreciate your time on From the Constituency. Thank you.
Pleasure as always, Dr. Calfano.